Hi everyone, welcome back to the channel. I'm Lizzie O'Connor, registered dietitian and mom of 2. Today we're going to be talking about how to feed your baby, whether it's with express breast milk or formula, and how to choose the best bottle for your little one. Whether you're exclusively pumping, supplementing with formula, or just want someone else to help out with feeding, bottle feeding can be the perfect option when baby's unable to drink from the breast. Let's start with the basics. Bottle feeding can include express breast milk or infant formula, which is the only safe alternative to breast milk. No matter what you use, the most important thing is that your baby is fed, growing, and loved. There are so many bottles on the market, and each baby is unique. Here are some key features to look for. First is nipple shape. If you're switching between breast and bottle, you might want to choose a wider nipple shape, which will help decrease nipple confusion. Babies with a shallow latch may do better with a more narrow nipple. Next is flow rate. I recommend starting with a slow flow nipple for newborns. This helps encourage sucking, but also prevent choking. Some parents may decide to increase flow rate when baby gets older, but it's not necessary. You can also look for an anti-colic design. These bottles feature a venting system, which prevents air from being sucked in and can decrease gassiness and fussiness in your little one. And the most important feature to me is ease of cleaning. Less parts equal less cleaning. Trust me, at 2 a.m., you'll appreciate this. One thing that really helped me was ordering a bottle sample pack. This way I could try different bottles on my little one early on. I also rotated bottles often to give her more exposure and decrease the chance of bottle refusal. This allowed her to be more flexible with feeding time. It's something that I recommend to all of my patients. I like to use a paste bottle feeding technique. There's a longer video where I go into more detail, but here are the basics. First off, you want to make sure that you have your bottle in a horizontal position. You allow the baby to take a few gulps, and then you tilt the bottle down to give them some time to register fullness and helps mimic breastfeeding. You want to look for signs that your baby's hungry, like rooting, hands in their mouth, or sucking, and signs of fullness, like turning away, fussiness, or pushing out the bottle. It's important to gently burp your baby halfway through the feed and also at the end to help release any swallowed air. Here are some bonus tips. Always check the temperature of the formula or breast milk before feeding the bottle to the baby. You also want to discard any leftover milk within an hour of feeding to prevent any bacteria. And most importantly, don't feel guilty if your feeding journey doesn't look like someone else's. Fed is best, being supported is essential. I hope this took the guesswork out of bottle feeding. Whether you're breastfeeding or formula feeding, the most important thing is that your baby's fed, loved, and nourished. If you have any questions about bottle types, formula, or paste bottle feeding, leave them in the comments. Don't forget to like, subscribe, or share this video with a new parent who could use some support. Until next time, take care of yourself and your bub.